Good morning, or afternoon, or whatever it is for you. It's good to be with you. I'm James Wolfe, and I'm looking forward to discussing goals and objectives in this short and sweet Camcast. I'm hoping that when we're done with this short presentation, you'll be prepared to develop excellent goals and objectives for the program that you're currently working on. We'll be covering a few basic concepts and then putting into practice what we've discussed. Surprisingly, we've done a lot of work creating program goals and objectives already because our program goals and objectives map very well to the logic model you've already been developing. This chart is our Rosetta Stone, translating logic model language into the language of implementation. Long-term outcomes in our logic model map to goals in the language of implementation. Medium and short-term outcomes map to objectives. Outputs and participation map to activities and also target groups, and input maps to resources. So let's move on and talk first about goals and then objectives, and finish with an opportunity to critique some goals and objectives from proposals of the past. You need to consider what you want to achieve in the future. For me, for example, one of my personal goals was to ski the Baldy Chutes in Alta, hence the photo. This was an ambitious goal for me and something I had to work at over many years. I think you get the idea. For your program goal, look at your logic model and your long-term outcomes and state as clearly as you can what you want to achieve in 5 years. Be ambitious and don't worry about measuring your goal. You don't have to measure goals. Usually we have one goal, sometimes two. Personally, I like to keep it simple and try to express what I want to achieve with a single goal. Developing a well-articulated goal will help you focus your efforts and will be useful in communicating about your project. Objectives, like medium and short-term outcomes, state the changes you expect will occur in infrastructure, knowledge, attitudes, skills, or behavior in order to achieve your goal. You'll probably need several objectives for each goal because there will be probably several expected results from actions taken during the project and several different groups who will be the recipients or participants of those actions. What are the characteristics of good objectives? Well, objectives should be SMART. That means they should be specific, measurable, appropriate, realistic, and time-bound. Specific refers to specific changes desired and specific target groups that will participate or benefit in the change. Measurable means that the objective can be measured to avoid differing interpretations of the cause of change. Appropriate is obtaining an objective that contributes to the achievement of the goal. Realistic means that the objective is achievable, challenging, and meaningful. And finally, time-bound means that there is a definite time period for achieving the objective desired. Developing a good objective, the key is choosing a challenging outcome, linking it tightly to your goal, and describing it with an action verb. Take an example of a SMART objective. The objective will always be in context of the goal. For this objective, the goal is to decrease transmission of HIV/AIDS from mother to infant among pregnant women attending antenatal clinics. The objective that we're going to consider is the following. By August 1st, 2012, 80% of pregnant women attending antenatal clinics in Mombasa and their newborn infants will receive nevirapine prophylaxis at the time of delivery. So what do we think about this objective? It seems to meet our criteria for specificity by describing a specific population, mothers and their infants, in antenatal clinics in Mombasa. It's measurable, certainly, because we can measure the number of women and their infants that get nevirapine prophylaxis at the time of delivery, although it will require getting information from mothers at the time of delivery and after they have left the clinic, and this could be quite challenging. As an objective, that would seem appropriate because it is well-known evidence-based strategy for reducing transmission of HIV from mothers to infants. Under good project condition, the 80% number would also appear realistic. Finally, it's time-bound because it states when this result should be achieved, August 1st, 2012. So we can say that this objective is SMART, specific, measurable, appropriate, realistic, and time-bound. Now let's move on to the next slide. I want you to hit the pause button after my comment here. Take out a piece of paper, open up Word on your computer, and analyze each of the objectives on the slide to determine if they're SMART. After you've done that, you can start the Camcast again and compare your analysis with my own. So, here are the objectives. Construct 10 maternal waiting homes during the first 2 years of the project. Reduce morbidity from malaria by expanding the use of bed nets among children under 5 by 50% in Jinga district by April 2012. And conduct a baseline survey in 4 districts of Hana province by March 2012. Now, it's time to hit the pause button, take out your paper, and analyze these objectives to determine if they are SMART. Welcome back. Let's compare your analysis with mine, remembering that there are many possible explanations and defenses or critiques of these objectives. The first one, construct 10 maternal waiting homes during the first 2 years of the project, at first pass looks like a SMART objective, but it has a few problems. It's certainly specific, measurable, and time-bound. You can count the new waiting homes and the new construction, and it has to be completed within 2 years. However, we don't know whether it's appropriate or realistic without knowing more about the project environment, so we will have to withhold judgment on those 2 criteria. How about the second objective? Reduce morbidity from malaria by expanding the use of bed nets among children under 5 by 50% in Jinga district by April 2012. Is this objective specific? To me, it really isn't that specific. It mixes both reducing morbidity from malaria with expanding the use of bed nets. Which one is it that the authors want for an objective? Perhaps reducing morbidity from malaria is the goal, and expanding the use of bed nets is the objective related to that goal. Expanding the use of bed nets among children by 50% appears to be measurable, but we don't know the absolute number without a baseline, so it isn't ideal. In addition, we can't tell if the 50% is realistic, either too low or too high. Since it's a well-known evidence-based strategy for reducing malaria mortality, it would seem appropriate, and it is time-bound. Now let's take a look at the third statement. Conduct a baseline survey in 4 districts of Hana province by March 2012. It meets several criteria for a SMART objective. It's specific, measurable, and time-bound. It might be realistic. We really don't know the conditions on the ground in Hana province. But for me, it fails on the appropriate criteria, in that it's not challenging, and much more likely to be an activity among many others for achieving a more important outcome related to health. Well, let's move on to two more examples. And again, I'd like you to take a look at these. Make your analysis about whether or not they're smart. Write your thoughts down. That's important to write them down. And then hit the pause button again, and you can compare your analysis with mine. Well, great. Let's take a look at this last two, and then I think we'll be ready to wrap it up. The first objective, by April 2015, 100 community health agents will increase by 60% their ability to recognize infants with ARI who need referral to a higher level of care. The easiest point to make about this statement is that it's time-bound. From there, however, things get murky for me. Does it really describe a change in ability of a specific number of health workers? What does it mean to increase ability by 60%? And why 60%? Does that mean that some CHWs have already have the ability? Or does it mean that if the training is successful, the trainers will be satisfied with a 60% success rate? That wouldn't be a very ambitious objective. CHWs, in the context of a training program for CHWs, recognizing and referring cases of severe ARI in the community would seem appropriate because it's part of the standard WHO algorithm for management of ARI. Measuring this ability, however, would be difficult. It's hard to measure ability in a written test, so if you have to have some type of practical evaluation, that would be more difficult and would make it more difficult to measure this ability, especially to have it reflect the situation in the field under normal working conditions. Realistic, maybe, but the measurement difficulties might push it over into the unrealistic realm. Now let's look at the final objective on the slide. A population-based registration system will be developed to track neonatal deaths in Aloha District by June 30th, 2014. This objective could be an activity, depending on the goal of the program. If the goal of the program was to reduce neonatal deaths, then this might work as a specific objective under that goal. You can measure whether the system is in place, and it is specific about the type of system and where it will operate. It's also time-bound. We can't say much about whether it's realistic because we aren't aware of the situation on the ground. So that's it for goals and objectives. We will look forward to seeing you in class and working with you on developing your goals and objectives for your exciting program. Take care.